diazinon 1 gram orally. So treatment for this poisoning is cholinesterase reactive therapy, pralidoxime chloride, pralidoxime iodide and pyridine, oxymethodiode, that is PAM, in a dose of 1 to 2 gram IV for adult and repeated after every 12 hours. Then second is DDT. Symptoms by oral route: salivation, nausea, vomiting and abdominal pain. And if it comes in contact, then symptoms are irritation of eyes, nose, throat, blood vision, pulmonary edema, dermatitis. Nervous symptoms include hyperirritability, muscle spasms and tremor. Convulsions include paralysis of limb muscles, collapse and death due to respiratory failure. Fatal dose of DDT is 150 to 1000 mg per kg of body weight. So, treatment: if it is ingested by oral route, then material must be removed by gastric lavage, and cathartics, fats and oil should be avoided. Adrenaline should be not used. If artificial respiration must be given, and if muscular twitching is there, then give barbiturate or diazepam for the treatment. Then entering symptoms are vomiting, abdominal pain, convulsions, oozing of wild fluid from mouth and nostrils, dyspnea, coma, respiratory failure and death. Fatal dose is 6 gram. Treatment can be given as decontamination, artificial respiration, barbiturates to control convulsions, 10 ml of 10% solution of calcium by IV for every 6 hours. Then naphthalene. Symptoms are acute nephritis, hemolytic anemia, jaundice and optic neuritis. After ingestion, it causes gastric irritation with nausea, vomiting and abdominal pain. There is a pain in urethra, urinary bladder and kidney. Urine may be brown or black. Severe poisoning may cause liver and kidney damage, resulting in convulsions, cyanosis, coma and death. After inhalation, it causes headache, nausea, vomiting, malaise, conjunctivitis, mental confusion and visual disturbance. Fatal dose is 2 gram. And treatment for naphthalene poisoning: keep the patient warm, stomach wash with warm water or saline. Use magnesium sulfate to clear the bowels. Administer sodium bicarbonate to maintain the urine alkaline, which prevent the formation of acid hematine crystals. Then blood transfusion may be necessary, and hydrocortisone in the treatment of hemolysis. Then second is heavy metal poisoning, that first arsenic. Acute poisoning symptoms are widespread damage to capillary, severe gastroenteritis, dysphagia, epigastric and abdominal pain, vomiting, watering or blood diarrhea, jaundice, oliguria, muscle cramps, pale anoxis face, sunken eyes, dilated pupils, rapid pulses, signs, respiration, followed by convulsion, coma and death. Fatal dose is 100 to 200 mg. Treatment: stomach wash with warm water, freshly precipitated hydrated ferric oxide or antidote, used as antidote, which forms harmless ferric arsenite. IV sodium thiosulfate 1 gram in 10 ml sterile water every 4 to 6 hours for the first day. IM dimercaprol as a specific antidote. Dose may be given as 3 mg per kg body weight every 3 hours for the first 2 days, then 3 mg per kg body weight for every 6 hours, and on third day, and then same dose every 12 hours till symptoms disappear. Morphine also can be given for the controlling pain. Then chronic poisoning, if it is there due to heavy metal, then there is peripheral optic neuritic diarrhea, conjunctivitis, pigmentation of skin, liver, cirrhosis and dependent of edema. It also causes palmar and plantar keratosis and carcinomas. A characteristic state or a ill health appear. There are 4 stages successively. Stage 1, related with nutrition, types of anorexia, occasional vomiting, diarrhea, easy fatigue. Stage 2, catarrhal conjunctivitis, running of eyes, running of nose, senses of fullness of head. Stage 3, skin rash, hyperkeratosis of foot, brittle nails, falling of hair. Stage 4, related with the CNS, convulsions and coma. Dose is 100 to 200 mg, that is fatal dose. Treatment can be done by removal of patient from exposure. Second, IV sodium thiosulfate 1 gram in 10 ml sterile water for injection for 2 to 3 times per week for many weeks. And dimercaprol dose schedule same as acute poisoning. Then lead poisoning. So lead poisoning, again there are 2 types, acute and chronic poisoning. So symptoms for acute poisoning are metallic taste, vomiting, colic pain in abdomen, constipation, black faces, urine suppressed, lead to encephalopathy, headache, loss of sleep, loss of vision, hallucination, delirium and convulsion. Acute hemolytic crisis may also occur. So treatment for the acute lead poisoning is stomach wash with 10% solution of magnesium sulfate followed with clean water. Bowels should be washed at regular interval. Calcium worsening, that is EDTA or penicillamine, should be used as antidote. Chronic poisoning, facial pallor, lead line, that is bluish black line on the gums. Anemia with punctured basophilia, presence of dark blue spots in cytoplasms of RBC, constipation, paralysis of muscles of wrist, encephalopathy, hypertension, nephritis, menstrual disorder, abortion. General symptoms include metallic taste, neuralgia, dyspepsia, headache, weakness, vertigo, and drowsiness. Fatal dose for lead poisoning is 0.5 gram. Treatment can be given by excretion of lead, that is diuretic, by acidosis, combination of EDTA and British antidote is all effective. EDTA, it is given 3 mg, it is mixed with saline and given by IV drip. BAL is British antilovist. Dose is 4 mg per kg body weight for every 4 hours. Then mercury poisoning. Again here, acute poisoning and chronic poisoning. So symptoms for acute poisoning, the main feature is metallic taste. Tongue, mouth become grayish white, nausea, vomiting, contents with mucus with blood, cold skin, pale face, dilated pupils, shock, renal failure and liver damage. For chronic poisoning, symptoms are multiple neurological disorders such as shyness, irritability, tremor, loss of memory, loss of sleep, hallucination and insanity. The disorder is also called as erethism, excessive salivation with metallic taste. It is a peculiar symptom, loosening of teeth with painful gum, colitis, anemia, hypertension, renal failure. Mercurial ND, there is discoloration of lens of eyes due to deposition of mercury. Treatment, removal of poison by emetics or stomach. Wash with 5% solution of formaldehyde, sulfoxylate, or you can use charcoal powder, 3 to 4 tablespoons with water, and British anti-levis in the usual dose. And chronic poison treatment, remove the patient from exposure, promoting elimination of mercury by kidneys and bowels. The dimercaparal therapy for chelation. For excessive salivation, dry extract of belladonna, 30 mg per 3 times a day must be given. Copper. So it is at a poisonic metallic state, but some salts of copper, that is copper sulfate, is poisonous. Okay, for acute poisoning, symptoms of metallic taste with excessive salivation and thirst, abdominal pain, vomit, green or bluey color, stools brown without blood, urine like ink containing albumin. Chronic poisoning symptoms are similar to lead poisonings, and dose, that is fatal dose, is 30 gram of copper sulfate. So, and the therapy or treatment can be done same as like mercury poisoning, that is 600 ml of potassium ferrocyanide in glass of water to be given before performing gastric lavage. For chronic therapy, it is similar to the treatment is similar to the chronic therapy of chronic mercury poisoning. Barbiturate poisoning. Symptoms are nausea, vomiting, mental confusion, respiratory depression, drowsiness, deep sleeps, cyanotic face, muscle spasm. Barbiturate automatism in few cases. Patient takes more drug automatically, forgetting that he has already taken a dose. Alternate contraction, relaxation of pupil, hypotension, decreased urine formation, death occurs due to the respiratory failure. Fatal dose is 3 to 5 gram. So treatment, first is gastric lavage with potassium permanganate, that give artificial respiration. So to elevate blood pressure, 2.5 mg of metaminol by IV route should be given, 5% glucosaline by IV drip, Coramine IV 5 and 25% followed by 10 ml in 15 minutes, and then 20 ml after every 30 minutes till reflux return. Then hemodialysis is recommended, forced diuresis and enema should be given. Narcotic drug poisoning, opium. The symptoms appear in 3 different stages: excitement, sopor, and necrosis. Excitement, pleasurable mental excitement with increased heart rate, stupor, headache, giddiness, a sense of weight in limb, itching, cyanosis, face, lips, ambiosis, strong tendency to sleep. And then narcosis. Patient enters into deep coma, relaxation of muscle, loss of reflex, pinpoint pupil, hypotension, lowered respiration, hypothermia, frothing from the mouth, and finally death. So fatal dose for this is 2 gram or 200 milligram of morphine. To treatment in early stage, stomach wash with the tepid water first and then with the solution of potassium permanganate. Second, continuous stomach wash till return water is of pink color. Color the intestine, clear the intestine by enema. Antagonist therapy, that is 5 to 10 milligram nalorphine by IV route every 50 minutes till dilation of pupil is observed. Naloxone dose is 4 to 0.4 to 0.8 milligram by IV every 50 minutes, and for shock 1 liter 5% glucose saline solution is recommended. Then cocaine poisoning, euphoria, dysphagia, mydriasis, dry mouth, numbness, heart rate, increased cyanosis, sweating, hallucination, black tongue, nasal perforations. Okay, these are the symptoms. A fatal dose is 1 gram. And treatment, gastric lavage with potassium permanganate or tannic acid, and in local application wash the skin with water, and patient must be given artificial respiration as well as cardiac stimulant therapy. Then belladonna alkaloids like atropine, datura, hyoscyamus. The symptoms are dry mouth, bitter taste, dysphagia, abdominal pain, skin mydriasis, diplomia, vomiting, giddiness, heart rate increases with increase in respiration. Fatal dose is 125 milligram or 50 to 30 milligram hyoscyamus. So treatment is medicinal charcoal can also be used to apply. Stomach wash with 5% tannic acid. Neostigmine 2.5 milligram IV every 3 hours or phyostigmine 1 to 4 milligram every 1 to 2 hours. Then sponging for raised body temperature. And for excitement, diazepam therapy must be given, that is in dose of 10 milligram by IV route. Then cannabis, that is excitement followed by hallucination, increased muscular movements, mental confusion, drowsiness, mydriasis, stiff sleep. Okay, so fatal dose by charas 2 gram, ganja 8 gram, bhang 10 gram per kg body weight. Okay, so treatment can be done by gastric lavage, saline purgatives, IV fluid, hypodermic injection of strychnine, and artificial respiration. Then is pethidine. Symptoms are dry mouth, mydriasis, flush face, tachycardia, hyperthermia, and drowsiness, and coma. Fatal dose for pethidine is 2 gram, and treatment given by gastric lavage, coramine, IV symptomatic treatment. Thank you friends. Thank you very much for your patience listening. Thank you.